Welcome to Literally Nothing Matters podcast. We have our friend Kim on here.
Our
And our
sister.
our sister. So we went to college with Kim, and she's married now with a baby, and she has so much wealth of knowledge to bring to all of us today. So welcome, Kim. Thanks for joining us.
Thanks for having me. I'm excited.
You. All right, so let's let you kind of introduce yourself and kind of explain to our audience who you are in this season of life.
Yeah, so I am Kim and I'm a mom of a 2-year-old boy, which is why I'm here to talk about his birth story. And prior to being his mom, though, or in conjunction with it, I'm a psychiatric nurse practitioner. I specialize in maternal mental health. So all of this is very in line with both my personal life, but also my career. I married my college romance that you guys knew, and yeah, here we are. I was living in New York, and then when my son came into the world, which we'll get to this, I'm now settled in Rhode Island and live a lot slower of a life here. So I
Oh,
don't know what else I can offer for an intro, but
perfect. All right, so let's jump into your birth story. So, like I was mentioning before we started this, you popped into my mind when we were talking about motherhood and this theme of Mother's Day for the month of May, because your birth story is so special and so unique, inspiring in ways and emotional and so many others. So, I want to let you kind of have the floor of introducing how your sweet boy came into the world.
yeah, and redirect me or stop me if I'm going too much into certain directions.
No,
But
please do.
yeah, I'll start with, I mean, I guess the whole pregnancy was super normal, super like very easy, thankfully. Um, and we were we were in Italy for 2 weeks or I guess for a week and a half for a baby moon right before my son came, which makes this whole story even crazier with the timing of it. So we'd come back from the baby moon and I was like, oh, I've got this like weird pain in my body. I wasn't quite sure what it was. I'm very healthy. I'm very active. We walked 10 miles a day in Italy. So I'm like, oh, I just like overdid it. I just moved like whatever, moved my body too much. And we went from Italy, we came back to Rhode Island. At the time we were living in New York, but we came back to Rhode Island because we had a wedding. I remember being at the wedding and I was like, I couldn't even like sit. Like I was just in like such weird pains. And I was at a wedding and a bachelorette party that same weekend, and all my girlfriends at the bachelorette party were like, "That's so normal. That's pregnancy." And like, I mean, it felt like that at the time, but my mom saw me later on, and she was like, "This something's going on. Like, you got to call your doctor." In hindsight, I should have called my doctor sooner, but obviously, hindsight's 2020. But so let's see. So if I was just like in weird pain. That was kind of the like only symptom I was having that I was aware of at the time. It like was just like weird, like almost like stomach pain. And so I called my doctor who was in New York. I messaged her actually in the portal. She didn't answer for a day. So I'm like, oh, she's not that worried then. And then finally
That
my
is
mom,
what I'm finding in healthcare right now. Is I'm like,
yeah,
I'm gonna mesh them in the portal, and then I'm like, what if it's something severe, like you're
yeah.
saying?
Literally. So I messaged them in the portal. They didn't answer. And my mom kept bugging me. She's like, you need to call them. Like this, like something's going on. And so finally I called and they were like, you need to go to the emergency room with a labor and delivery and a NICU immediately. And that's all they said on the phone. And they're
Wow.
in New York. I'm in Rhode Island. And I remember my husband was like in the midst of this like really intense time period at work. So I was like nervous to tell him like, hey, you have to drive me to the hospital and we have to go to the one an hour and a half away, like because it has those things. Um, and so he was fine. He was more than like willing to take me, but on the way we like stopped for ice cream, like not in an urgency at all. And once we got there, thankfully they got me in and saw me and everything. But it took about like 6 hours for them to figure out what was going on. And what happened was they just kept escalating it. Like, you go into the ER and first it's like the nurse, and then it's like the PA, and then it's the med student. And it just kept escalating to be like people that were more serious. And we didn't at that time still didn't quite know what was going on. I think behind the scenes they probably did. And it's probably like hour 5 or 6 into being there, and they said, your labs are coming back as XYZ. Like basically my liver was in failure, my platelets were like at a very dangerous level where like my body wouldn't be able to clot or wouldn't be able to work in the way it needed to work. And then my blood pressure was like through the roof, and to the point where they got 4 different blood pressure machines because they were like, "You're so healthy. You just ran a marathon." Like, and so they like didn't believe the numbers for anything, which I think added to like my husband's and I were kind of like, I don't want to say we weren't taking it seriously, but we were just kind of like, oh, like we'll be home. Like I remember at 6 or 7 at night, I texted my mom, like, oh, we'll be home by 10 o'clock. Like, don't worry about the dog. Like, we'll get the dog when we get home. Like, we were still in the mindset of like things will be fine. And so eventually at maybe like 10:30, 11 that night, things were not fine. And the doctors came in and literally were like, you need to deliver your baby right now. Like it went from like sending a text, we'll be home soon, to like, oh, this is crisis. And I
And
guess
how many weeks pregnant were you at this
I was
point?
Yeah, that's what I
28
was
weeks.
gonna
I was
ask.
gonna say, let me backtrack. I was 28 weeks pregnant, so I
Ugh,
was still in my second
Scary.
trimester. Yeah. I was 12 weeks till my due date. So it
wow.
was
And so
scary.
obviously not expecting to deliver at this
No,
point.
I
Yeah.
didn't. I was in my Hill House dress with my like with my flip-flops, did not bring anything with me. Like, I would not have had a hospital bag packed at that time, but that just shows my mindset where like going to the hospital, I didn't even think I would need to bring anything to stay over. Which maybe in hindsight I should have, but I was more worried about getting my ice cream.
Yeah.
Fair
So,
enough.
yeah, so they said like, that in hindsight, all the doctors were like very professional. And I think like I've done a lot of work with my therapist, kind of processing the trauma of all of this. And I think the doctors being so direct and also so non-negotiable about it, but very informative, was very helpful for us to be like, oh, we don't have an option. This is very serious. But we also felt in very good hands based on like the way they delivered everything. And I think like unfortunately what I see with a lot of my clients is like that is not the norm for doctors to deliver news in that way. And I think it really set the tone for us to be going through something extremely traumatic, but in a way that felt like we were being like held and secured by the safety of our medical team. And they, they were like, we'll do everything we can to make sure that like you get through this okay. Because at the time, my son was healthy. There was nothing wrong with him. It was me. And they basically said, like, if I like the only cure for me to live was for my son to be born. If he was not born within 24 hours, I would die. And I don't think I realized that till like months after, like how serious that is to hear. And on top of that, they were like, I was at a very high risk of seizures. And so there's just a lot of things that went on behind the scenes that we didn't really recognize as a worry. A, as like a normal pregnancy. Like these are things I never even knew could happen if you're pregnant. And B, didn't really know at the time. Like they were just like, oh, we're gonna put some padding on your gurney just in case. And I'm like, just in case what? They're like, just in case you have a seizure and you pass out. And it's like, well, like that's crazy. Like I was like strapped in because of this risk.
Uh-oh.
Um,
My gosh.
yeah, so and then the other like, hard part was it was midnight. And so we reached out to our family. Their phones were all off. And so we actually didn't get a hold of anyone besides my husband and I until like 5 a.m. when our family started waking up and saw the text. They're like, oh my God, like what happened? Um, and I think obviously in that moment, I'm like, oh, I want my mom, and like, wanting that support. But so fast forward, they wheeled us upstairs. They kind of prepared us for like, they had the NICU doctors come in and said, like, this is what you can expect for your son, and gave us like a really optimistic picture of what it meant. Because even though I'm in the medical field, hearing a baby born at 28 weeks, I'm like, are they going to live? Like, are we going to lose our baby? Or are we going to have a baby that then we have a lot of medical complications or completely changing our perception of what it was going to mean to be parents. And I think no matter when that happens, that's really hard. Like whether it's something that comes up in like genetic testing that you find out and then you make a decision to continue with that pregnancy, or whether it's happening like for us out of the blue where it's like all of a sudden in the blink of an eye you have to reevaluate like what your expectations are for your role as a parent and for what your kid, like the possibilities for your kid. And thankfully, though, they were very optimistic of like 98% of babies born at 28 weeks live a normal, healthy life, was the way that they worded it to us, which was a very good statistic. You know,
Yeah.
I think they are cautious with their words of like normal, healthy life because there are a lot of things that come up. But again, we were very fortunate. And they prepared us for what to expect. They're like, you're going to be in the NICU for 3 months.
Wow.
And
Oof.
And of course, this is nothing that you would expect, and especially a first-time mom that you
yeah,
have no
first
idea what
time
to
mom.
expect anyways. So I bet
And
it,
I was healthy, and I think that's one thing I've learned too, is like a lot of people go into pregnancy, if there are high risk, then they know what to expect. They get a
Yeah.
NICU tour. Like people, some of my patients go and get a tour of the NICU to know what to expect if they know they have a high risk of something. So I think the fact that I was so healthy and kind of, I don't want to say lackadaisical about it, but was just assumptive that I would have a normal pregnancy, really shook us of, wait, this can happen to anybody. This can happen to us.
The
And
doctors, sorry, did the
yeah,
doctors ever like give any indication of like why this was all
no,
coming
and they still
on?
don't know. Like they
Oh, that's
say
so crazy.
that there is no, like there are certain risk factors that you can get. So what I had was called HELP syndrome.
Okay.
And it is a severe form of preeclampsia. So basically preeclampsia is when your blood pressure is really high during pregnancy, which can happen for a variety of reasons, whether it's something you already have medically or um maybe like just the way your body's responding to the pregnancy, I guess. The HELP syndrome is when your blood pressure is so high that your organs start to shut down. And so that's what was showing up in my blood work, was that like my liver was shut down
wow.
and that various other functions of my body were not working because the blood pressure was basically shutting off access to the other parts of my body. So they don't know why it happens, and there is nothing you can do to prevent it, which is really scary in the idea of a future pregnancy.
Yeah.
And there's a risk of it happening again, but they are optimistic of like, oh, if you take baby aspirin and we know to monitor it for you, so you would get blood work every week and blood pressure done every single day. Like they would say essentially we would either catch it sooner or the aspirin would prevent it, hopefully.
Right.
Um, so yeah, there's nothing that they were like monitoring for me for this. And I think one of the risk factors is like if your parents had preeclampsia,
Mhm.
and my mom did have it with my brother, not with me, and not this severe at all. She just had, general preeclampsia. But yeah, I think that's the scarier part, is it's like not on my radar whatsoever.
Totally.
Yeah.
Of course.
So they've set me up with like the Pitocin and they're like, oh, we're gonna induce you. And I think like, I don't know, all along for pregnancy, I was never somebody who was like, I need a natural birth or I need like anything. My birth plan was always like, let me just get through this and get to the other side with a healthy
Mhm.
baby. Like from day one, that was my mindset. I was like, I don't really care. Give me the epidural as soon as possible. Like,
Absolutely.
and so in that moment, though, I think it was really hard to imagine giving birth to a baby that was 2 pounds and that was not in the way that you would like envision it. So they set me up with all the drugs, the epidural. Like it actually ended up having contractions because of the Pitocin. They gave me an epidural and they're like, let's try and do this naturally or vaginally, before we consider a C-section. But the tricky part is when a baby's born that early, they give you a shot, they give you a bunch of medicine to kind of help like rapid fire develop the baby. So they give you a ton of, it's called magnesium drip, and the magnesium helps develop the baby's brain like really quickly in
Mm.
a way that they optimized for preterm birth. And then you get, I'm blanking on the name of the shots, but you get shots that are one every 24 hours, and you get 2 shots. And the idea is that these shots are going to quickly allow the baby's lungs to develop. So if someone is going into preterm birth, they're going to give you these shots immediately in the hope that you can make it 48 hours to get both of them, because
Yeah.
the betamethasone is the name, because it increases the baby's chances of having less birth or less respiratory complications if you can get it. So they gave me all of that when I was still in the ER. They started the magnesium, they gave me the shots. And all along, my husband and I are like, okay, so we want to make it at least 24 hours so that we can get the second shot. But then I don't know why they started me on inducing me, if that's the case. Maybe I think his heart rate was starting to take note, like to deviate or something. So like 5 p.m. the next day. So mind you, this is like I got to the hospital at 5 p.m. the day before. They told us this is going to happen at 11 p.m. So like almost 24 hours later, they were like, okay, this is not progressing. You need to go in for a C-section. And so they gave me like a 45-minute prep of like where you're next up basically for the C-section. And I think I was like relieved to have that. It's just like wild to say like that you're relieved to have your body go into that, but I was relieved in the sense of like, okay, like we're just gonna have this done with. And then I didn't have to, as strange as it is, like I think I was almost more worried about the like physical recovery of a birth, like vaginally, than from the C-section. I don't know why I thought that, but so I was almost like relieved when they said that C-section was a normal C-section. And with him being born so early, there was like there was, what my husband and I remember is in the OR, there was probably like 30 doctors and nurses,
Oh my
which
gosh.
for a normal OR for C-section, there might be like 5 to 8 maybe. But there was like the whole team working on me, but then there was the whole NICU team in there too. And so it was just very busy and very like chaotic, let's say, which I'm sure is that's the case for a normal C-section, but that's what we remember of just being like, oh my gosh, there's so many people in here. Fortunately, my husband was able to, Greg, he was able to be a part of it. Not that we could hold Henry. And I don't know if it's too much detail to go into, but when a preemie is born, they wrap the baby in like cellophane almost, like plastic to help maintain their body temperature and heat. And so like the first picture we have of Henry is like he's in his little isolette and like wrapped in like plastic, which is, you know, wild to think. And like Greg's little finger or big finger through there with Henry's little finger. And so like I think we've had to really, like, that's the only experience we know for birth. And something that's been coming up with me in my own therapy is like, oh, you see everybody's pictures, especially today,
This
like this,
time of year, everyone
yeah,
is
it's Mother's Day,
posting
like there was
their.
a thing on Instagram yesterday. It's like, oh, post your first photo with your child. And, you know, I, at the time, like, let's say the first like 6 months after birth, I was like really, like when I would see pictures of like those first pictures, I was like really proud of myself in those moments. Like I would look at the picture and it was like a really positive feeling of like, oh,
Good.
so proud, like of the person I was in that moment. And it's interesting now, like my son's almost 2, looking at those pictures, it's much sadder because it's like, oh, I now know what it could be, or like maybe the grieving is setting in a different way. So going back to that moment, you know, they wheeled Henry over for me to see, and there's, you know, the picture of me putting my hand into the isolette, and then they whisked him away to the NICU. And Greg was able to go with them, which I think
Good.
is really good. Yeah, and I was so drugged up, I didn't even notice, like, I didn't even notice that any of that had happened. I don't think I woke up until he came back, which was a couple hours later. So he was able to go down there and like get set up. The way that the hospital was the NICU was like the floor below where the labor and delivery units were, and then the whatever where women go after, like the antenatal unit, I guess. And so they brought Greg down there, and then once I kind of came to, I want to say it was, so like Henry was born at 7:30 at night. I want to say it was like maybe 1:30 or 2 in the morning. They brought me down in my gurney to like be able to see Henry down there and meet him, which tearfully was amazing, but also very sad. But I forgot one big piece to all of this story, which is like very full picture, is that he was born on my birthday. So all of this happened and it was my birthday. And I remember saying to the ER doctor, like, when they said like, "Oh, you have to go in and deliver your baby," I was like, "Okay, can I just go home and have my birthday and come back after my birthday?" And they were like, "Ma'am, like you're gonna be sharing your birthday with your son. Like, I hope you're okay with that." They're like, you cannot leave this hospital. And also, like, you need to be willing to share your birthday with your son." Um, but I think that's really important because I don't know how it would be otherwise, that's all I know, but I think that for me to conceptualize the whole experience, it gave me insight of like, okay, like this had to have happened for a reason, and it makes sense of like, maybe that's, I mean, he literally saved my life by being born on my birthday, which is wild. And so I think
It's crazy.
that helped us like process the whole situation. Not to say we didn't experience the trauma of it, because we did, but I think it helped us to maybe accept that there was nothing we could have done, and accept that like it's a miracle and a beautiful thing that did happen, and that we were able to share birthdays. And thankfully both of us were very healthy. He As soon as he was born, they did my labs and like were monitoring me a lot for the next 24 hours. Within like 6 hours of him being born, my body was back to normal, which is wild.
That is crazy.
Yeah. Yeah. So, I mean, that's the moral of the whole 24-hour of the birth story, but I have I don't want to keep going into that, but I'm happy to pause. I can talk about the NICU, like whatever is helpful or interesting for you guys.
Oh, there's so many things that I was just making note of. My
Yeah.
favorite one thing was I'm so happy you said that whole Mother's Day thing that's going around, because I felt the same way. I had an emergency C-section with my second a couple months ago, and I
Yeah.
felt the same kind of maybe shame. I don't know the word for it, but I was like, "Oh, I'm gonna go back and look at my first picture with
Yeah.
Alice," and I realized I didn't have one,
Yeah.
and I kind
Yeah.
of put a little bit of shame on myself of like, well, why wasn't I more coherent, or why
Right.
couldn't I pull it together? Like that's such a special moment. And
Yeah.
it of course was
You were
special.
fighting for your life.
Yeah.
Yes.
Yeah.
Exactly. So
Yeah.
I appreciate you saying that. I think a lot
Yeah.
more moms probably feel that same way, and it's not talked about on social media,
No.
Yeah.
which I definitely want to get into too.
Yeah.
But I do want to also mention, I remember when you were going through this whole experience with your son, and I remember you had made a platform and were kind of giving everyone updates on him, and I was stalking you and loving all of your pictures and
Thank
reading
you.
up to make sure like, little Henry, what do we call him? Little Henry Big Dreams, is that what it was?
Yeah. Oh my God, you're
Yeah.
sweet. Yeah.
No, I really did. I loved reading about it. And I just remember looking at your pictures and being like, wow, if I was in that situation, like, I don't know what I would look like. I remember thinking Kim looks so beautiful. She looks so
Oh,
positive. Like everything you were saying sounded so optimistic.
yeah.
And so I'm curious, is that really like just kind of, you just put, like my husband always says in hard times, he's always like, you put your head down, you put your boots on, and you go to work type of thing. Is that kind of how you were feeling, or like what was going on behind the scenes for you?
Yeah. Well, I think that's one thing where, like, even going back to the entire experience, like from being in the ER until he was born, like my husband and I were very, I think it's just in our nature to keep things very, I don't want to say positive, but like optimistic might be a good word. So, like, that whole time we were playing like really fun music and like laughing, and like nurses and doctors would come in and be like, "You are the sickest person here, and yet your room is like the most full of joy."
Oh,
Wow.
So
just gave me
and
chills.
like, yeah, and I think it's just in our nature where you know, in the moment, I remember my like mom and my grandfather calling me, and they were like, "No stinking thinking, like you can't let your head go to like the bad places." And I think, you know, naturally my husband's and our mind goes to that, but I think even that mantra like really helped us get through those moments. And to your point, I mean, that was the reality for the most part, that what was reading that we were really positive and really optimistic. I think the emotional pieces were certainly there in like the fact that it was such a hard transition to parenthood and that we had to really grieve our expectations and grieve what that looked like. That's been the takeaway from me of the whole experience of what I've worked on in therapy is like it's so much grieving of
Mm.
this like of like what my expectations were, but also of like the loss of like what is quote unquote normal for this time period. So I think like the positive stuff, it really was how our minds thought, but I think it was like a survival tactic almost, where it's like we had to be in that headspace, otherwise our thoughts could go really dark places and bad, and especially in the NICU because like babies are very sick there. You're hearing terrible stories like about what's happening in the rooms next to you. So I think that we like I almost want to say like there wasn't an option except to think that way for us. And I know that's not true for everybody, and I know that's not normal for everybody, but we almost like didn't allow ourselves to have a negative outlook on it. And it goes back to, I think, still that concept of like, okay, he's here on my birthday. Like, how can I not see that as like a sign? And like
Mhm.
the language I used on the website you're talking about was like, oh, he's my North Star. Like he literally gave me the light to live. And then now by watching him grow and like the miracles that NICU babies perform in order to just like breathe is amazing. And so I think like every day celebrating the fact that like, oh, he's gained an ounce, like
Mhm.
is like that was monumental. And so I think there like that is what gave it that there wasn't really an option because we were so excited for these really small things that you wouldn't expect to have otherwise.
Yeah, 100%. I feel like so my sister also had a preemie
Hmm.
and not crazy in the same way, but in different ways. So we were at
Yeah.
a wedding in Illinois, like,
Oh, so
and
traveling.
so she had a baby there. And but I'm hearing so many like parallels to her story of for the optimism, it's like just focusing on like one day at a time. And I feel like that's what her and like her nurses would always try to have her focus on of like, what's a win from today? And like, what are we focusing on today? Not thinking about the big picture and not thinking about like, oh my God, we've been here for so long, or like, when do we finally get to go home?
Yeah.
Like, just thinking about those things, but then also taking the time like after the fact to mourn what you've been through. Like, she definitely felt like she needed to mourn like what her expectations were for like her third trimester and her maternity leave and all of that because it was
Yeah.
so different. But
Mhm. Yeah, that is exactly it. I remember we went to the beach. I mean, thankfully, while he was in the NICU, like he was in good care there. And so we really prioritized our mental health. And so we
Good.
came up with a routine where it's like we would stay up there for basically like 24 to 36 hours and then come home for 24 hours. But we'd still be there every day, but we'd stagger it where we'd like leave at 2 p.m. one day and come back the next morning at 8 a.m. or whatever. So I remember shortly after we came home, I was like at the beach for just a mental health moment. And
Mm.
I had, and like, again, I now realize this happens for all moms after they give birth, but I remember being so hypersensitive to being like, wait, I still like look a little pregnant. And like, people are going to ask, like there was a lot of body image stuff that came up because like people are going to be like, oh, like how far along are you? Knowing that if I had just had a baby, I'd have the baby with me, right? And so it was like this really weird thing of like, well, how do I share this? And that was my feeling the whole time. Honestly, even once he came home of like, how do we tell this to people either when they're like, oh, you were pregnant and now you're not, but where's your baby? Oh, he's in the hospital. Like it just was like really um not, there wasn't shame. It was just like, it was very triggering for us, or for me at least, to
Totally.
how to navigate that. And yeah, we really had to take it one day at a time. Things in the NICU changed really quickly. And so there were moments where we'd get a phone call and they'd say, "Hey, things aren't looking good. Like, you guys should probably like come up here." And thankfully nothing was ever like really scary or serious, but it's still getting that call and not knowing, or even maybe not getting the call, but not, but like anticipating, oh, is the hospital going to call us and give us, some scary news? Um, so you're basically like on fight or flight the entire time. And so I think to persevere through that, that's where the positive headspace was like, okay, we're celebrating every win. We're here, like I think my mindset, and maybe this is coming from mental health, was I was so focused on like, and still am as a parent, I'm like, okay, like I want him to feel loved and feel validated and feel all of these things. And so in my mind, I think part of it is like I needed to be strong for him and needed to be able to be there for him to grow. And the one thing they kept telling us in the NICU was like, the best medicine for a baby, for a preemie, is like a parent's care. Is like the skin to skin, is like being physically there. And so we needed to make sure that we were in the right headspace to do that. So I think the emotional moments were in these like times maybe outside of the NICU, when we would, see families walking down the street, or um when like, I'm trying to think of the other moments. I mean, nights, like I was pumping the whole time. So I was getting up every 3 hours to pump, but then like there wasn't a baby at home with me. So I think it's those moments that were definitely challenging, but it was more in the context that are like the transition to parenting, almost more so than like our fear around him specifically.
Wow, you are a superhero. I
Seriously.
think this is why it's so important to talk about birth stories, because everyone goes through a unique experience and yet pretty similar to each other, right? Like I'm feeling a degree of what you felt, and
Yeah.
been through two births now. It's like it's really like gets to me.
Yeah.
And I'm like holding back tears almost, because I'm like,
Yeah.
this is incredible, and I've been through shades of it, but it's so important to talk about, and I appreciate you sharing it because
Yeah.
it's a
Well,
lot, and knowing we're not alone is nice to hear too.
I think that's the key thing. And that's what I say, with being on the other side of the field of helping people navigate through this, is like, no matter how perfect your birth goes, or how easy it was, or maybe it went better than planned, right? It can still be traumatic. It can still be emotional, or it could still not be what you expected, right? Maybe it went as planned, but it doesn't feel the way you expected it to feel.
Mm,
And
Hmm.
so I think normalizing the fact that that's okay, and that also like it doesn't matter if somebody's, and I hear this a lot where people are like, oh, well, like you went through something so much worse than I did. And like, I can't feel the way I feel then since you went through it worse. And it's like, no, like everybody's story is important and valid because it's what you feel about it and your
Yeah.
experience. And so I, appreciate, to your point, sharing birth stories, because everybody can relate to pieces of it. And like, I think maybe the takeaway is like the feelings are the same despite the
mhm.
experiences being different.
Hmm.
Absolutely. And I love that you have kind of mentioned throughout this conversation the idea that you worked a lot through therapy and you prioritize your mental health. And so I definitely want to go down that road a little bit. What did therapy look like for you? What does it look like today? What are some things that you learned that we can take away from you?
Yeah, so at the time I was with my like therapist that was from New York, who I'd worked with for a while before it, and she was not specialized in birth trauma or any of this, but she stayed with, basically once Henry was born, we were living in New York at the like full time at the time. And so we quickly like moved to Rhode Island like as soon as possible. We had already had a house here, but we were living like, it was like a second home. So we left, like ended our lease in New York and just moved to Rhode Island full time, since that's where our family was. So my therapist stayed with me until I was settled and then was like, wait, you live in a different state, you need to find some. But my point is that immediately I emailed her like a few days after or shortly after and told her what happened, and she was a mom herself. Her kid was maybe a year or two older than Henry, and she just responded like, okay, like let me know when you want to check in. And her one piece of advice in that email was like, I really recommend that you like write down your birth story right now, because that is such a like healing part of the process, no matter how bad it or emotional it is to do. And I think that really did help. Like that really helped me just get it out of my brain. And like still to this day, it almost doesn't feel real what we went through, which is very normal for trauma to like question, like, did we go through that? But having had written it down right away, I think really secured some parts of the memories that are important in your healing journey or in your like trusting of it. So writing it down right away was like, that is the number one tip that I give people, as hard as it is, but just that it's so important. Even voice notes. And that's something my therapist has reflected a lot to me, is like the whole time we were in the hospital, I was actually doing voice notes
Hmm.
about what was happening. Um, I think it came from a place of like terror almost, let's say. Like I was so frightened that I was leaving voice notes of like, oh, Henry, if I don't make it, like, I love you, like those types of things.
Mhm.
But then also talking about like, oh, the joys and all of this stuff. So I think all of that, though, as emotional as it still is, was really formative for like processing everything and for holding on to the emotional part of the journey, because that is like, if we push away and ignore those emotions, they're just going to bubble up some other time. So
Mhm.
I think me like live documenting it, even though that wasn't my intention at the time, has actually been a really helpful thing going back now. Not that I go back and really listen to it, but just having had that context. Um, so then once I ended with that therapist, I found somebody who specializes in like maternal mental health and birth trauma and something called EMDR, which is specifically for reprocessing trauma. And so it's something that just being in this field, I knew I wanted a provider who had that skill set. Not to say we would necessarily do it, but just that we could if we needed to. And I mean, therapy now it kind of looks different every day, like, or every week. I meet once a week, but some weeks we do talk about this. And then there'll be 3 months where nothing related to birth comes up and it's more just like the day-to-day things. And then all of a sudden something hits me, um, where it comes up again. And so we'll kind of go back to some of these moments, and we have used something like EMDR. So it's definitely been, I think, what's helped me stay in a good headspace. And most of the time, I don't want to say I don't get emotional, because clearly I do now, but I think the emotions are normal and like healthy to have. I think it allows me to feel the emotions in a healthy way, and then to cope like effectively, which for me is always running and, I don't know, talking, I guess.
Yeah.
But running, journaling, talking, and um, I'm just trying to think of other tidbits of things for from
It is
therapy.
individualized, like you said, too.
Totally
So,
is. But
you
I
know,
Yeah.
love, I do love that you kind of like the way that you're referring to therapy and the way that you're using it, because I think so many people think like you, need like this really horrible thing to happen to need therapy, or like you can process it and then like you can be like check done. But it really is like a tool in your mental health, like toolkit, if you will, like a maintenance tool. And sometimes you have to reprocess some trauma, or like you're triggered and things come up, and then like months go by and you don't, but you still have that
Yeah.
weekly appointment or biweekly or monthly or whatever it is that
Yeah.
you need.
Yeah.
And I think that honestly, to me, is a relief to hear. And I hope other people feel that way, whether or not it's about maternal stuff. Like, I feel like so many of us could use just having
Yeah.
that care
Yeah.
about our mental health.
Yeah, I mean, I call it just like a sounding board, a place to like throw what's going on through your brain for like 1 hour a week, and just to be able to like externalize it in a way to like, for me, it almost has me step it back and be like, oh, wait, like, yeah, like that does make sense. Like, it just gives me a lot of clarity, I guess.
Yeah,
But to your point, yeah, I think a lot of people wait until there's a reason to go to therapy, whereas I like to view it as like, hey, let's have therapy be preventative, right? Like, let's have it
yeah,
be so that you can be in a good headspace when something comes up. And who knows, maybe that's what helped myself and my husband process things in the way
totally.
we did, because we both have been in therapy for a while, like
Yeah,
before going into this even. So, and again, I don't want to say like it was easy, like it was hard, and it was very emotional and very sad, but I think we were able to cope in a way, um, because of therapy being a tool. And I always say like therapy is a tool that makes all your other tools more effective. So,
mm,
um, it's something that is just something else in your toolbox to pull from, and that it's also like a I like to think of it as almost like a putting things into reserve, right? Like almost like a bank account, an emotional bank account, where it's like, okay, like you may not need the therapy today, but if you're putting the work in and building that resilience and building those coping skills, that you have that to pull from when you
mhm,
do need it. And that, I think, speaks to something like what we went through, where it's like, okay, we had certain skills that maybe we didn't formulate or know that we were going to use, but it helped in the moment. And then helps now as like things come up even years later, and times where I'm like, wow, I totally didn't expect to be triggered by that. And I was.
yeah.
Definitely. Excuse me. So I want to jump into something super fun. You just launched your new account on Instagram, and I think it's called My Tribe Care, right?
Yeah.
And it supports mothers in the postpartum and pregnancy period. And so I want to talk about like what made you create this group. It's already so stellar. I want to talk more about it, but
Thank
like what
you.
made you start this?
Thank you. So it's like a story that has many dimensions, but I think it was stirring in my brain for a little bit anyways. I got in the fall, so like 6 months ago, I started doing like a specialist training for mental health, for postpartum perinatal mental health, basically. So I'm already in the psychiatry world. This was like an extra level of training to be, specialized in it. I just did my certification for it a few weeks ago, so I've got the full certification now. So I was already thinking of like, okay, I want to be able to help moms more specifically and more directly in my care, in my own private practice. A lot of my patients already are coming into the age of being a mom or they're postpartum, and I wanted to have a certain set of skills to help them. I think too, for me, I'm an eternal learner, so me learning something then helps me reflect it on myself. So I think part of it was also, hey, like this is helpful for me and my experiences. And then in like Christmas time, I had a friend's husband reach out to me, and this goes into the My Tribe piece. He reached out to me of having had his family, or his wife had gone through, a challenging course. And so he said, Kim, like, let's put our heads together. Like, is there something that we can create that can help moms like through this emotional period, and in a way that like there's such a gap to healthcare now? I think that, that really sparked my brain of like, yes, like I went through the NICU, and at not one point did anybody contact us to be like, hey, how's your mental health? How are you doing? Like, here's a
It's
support group, here's
crazy.
a therapist. Like, not one point, not one
They
point.
make you fill out a lot of forms though, every
They fill
time.
out forms. Yeah, right. And that's, I mean, that's something I've talked a lot about with the creation of My Tribe is like, okay, you fill out forms, but then like, I've had so many people say, oh, I checked the boxes and nobody even followed up with me. Like, which is crazy. Like you say you're depressed and nobody said
Yeah.
anything. Or there's just so many gaps of like, no, like the OBGYNs aren't following up and checking in, and on someone's mental health after something bad happens. And so My Tribe, the hope right now, we just have a social, or I just have a social platform in the sense of like wanting to build momentum around it. But I'm working on developing a website right now, and the hope is eventually to have it be a landing spot for anybody in any point of pregnancy, I say that for parents, not just moms, but non-birthing partners too, to get information, education, and resources and support for anything emotional that comes up during that time. And so the hope is to have courses on like what to expect emotionally and how to cope and what's normal versus not normal. And then to have a community piece where, there's ways to break out, like parents who have gone through certain types of things and they can connect with one another. And so really wanting nobody to feel alone in this experience of either, hey, like these are some educational tools that can help you understand it, or hey, here's some moms that either are going through it or who have been through it, and they can say like, I get it, you're not alone, and it will get better. And I think for me, that was like the one thing that the NICU had was a Facebook group. And the Facebook group, as we all love to hate them, this one actually was helpful of really seeing the bigger picture of like all the stories of parents saying, oh, my son was a 26 weeker, I had a 27 weeker. And then the kids are now 4, 5, 6, whatever years old. And it was really helpful for me to have that context of like, okay, there's a life outside of this exact moment in time. And so all of that formulated the idea of my tribe is like in the hospital in the NICU, like the nurses kept telling us like, hey, we are your tribe. We will get through this. We are your support system. And I said to them, I'm like, yeah, but like, what about when I leave the hospital? Like, how am I supposed to do this on my own? As every mom feels, right? Whether you were in the NICU or just you get your baby and you're gone 32 hours later, you're home, right? You're like, there's no instruction manual. And so the idea for my tribe is like this platform can serve as like the support system, the tribe, the collection of people that really can help guide you through the emotional pieces of this journey, because we all have the birth plan and we have the expectations for like, oh, this is what's going to happen to our bodies, but there really is not a piece or a big enough piece of the conversation about the emotional side. So that is the hope for my tribe. It is very early in the stages, but it's a very much passion project of mine right now.
I love that. There's already so many. I would think that I have gone through and like liked every single one of them. And I'm like, oh yeah, I get that, girl. Same. Yes. I'm
Shameless
like,
plug to my new platform, but thank you.
yes, no, I really recommend everyone go follow.
Yeah, that's
I
gonna
feel
help
like,
so many people.
yeah, it really is. And there's so many things on there that I'm like, oh, you feel that way too, like already, and you just got
Thank
started this week. The
you.
idea of like feeling guilty for doing like being on your phone instead of like being present with your kid 24/7. I was like, oh my God, I'm not the only one.
Yeah.
And it's little things, right? It's like we just want to know we're not alone in it.
And
And
that is
so go ahead.
normal. Yeah.
Yeah. So I think that it's gonna be fabulous. Um, all right. I think that that's kind of all the questions I had. Mandy, did you have anything you wanted to jump in with?
No, honestly, this was such a nice conversation. I feel like I do not have children yet. However, I feel a lot more hope for the day that I do, that there will be resources like what you're creating. So happy days, good times ahead.
Yeah. Yeah. And that's where like I think to try whether it's the platform I'm trying to make or even just these conversations, right? It's really just trying to normalize that like it's okay to not be okay, but it also will eventually be okay,
Yeah.
right? I think that's the important piece is instilling that hope of like this is a really hard moment. But there will be another side. And that's like for us in the NICU, we were there 51 days. Those 51 days felt like 5 years.
Yeah.
And I think that the hope was like literally the only thing that allowed us to keep moving through it, because knowing that whatever you're going through, right? Whether it's something medically with your kid, whether it's just the transition to daycare, right? Like there is hope that like this is just one discrete moment and like it will feel differently with more time. And that a lot of parents have gone through it too.
Yeah, definitely.
Absolutely.
Oh,
Thank you, girls,
Thank
for
you.
having me on. This is so fun to catch up.
I
Not
know.
to say fun, it was an emotional moment, but I appreciate you guys having me here.
It's important. And where can people find you if they want to connect with you?
Thank you. Yeah. So I've got two socials, my tribe, which is my tribe care, and then I have a general work social, which is more just general mental health, psychiatry, private practice based, and that's my name, Kim Meehan _NP. So yeah, so those are very exciting things hopefully to come on my tribe care though.
Thank
Yeah.
you.
Thank you so much.
Yeah, thanks girls. Good to see you.
Good
Very
to
good seeing
see
you too.
you.